Welcome to Love Talks. My name is Sharon Gilmore, and I am here again. I'm super excited. Dr. Townes, you are back in the building.
I am. Thank you for inviting me back.
You came back quick too, girl.
Well, we had some unfinished business.
We have some
And-
unfinished
And
business.
apparently, some of your audience wanted us to focus on this topic. So
First off, I'm very grateful for you to come on, be the first guest to share your wisdom, and people began to text and email. I got DMs, and people were saying, clinicians, therapists, coaches were saying, thank you so much. Thank you for the responsibility that you took to clarify. And so I called you up and was like, we got to do a sequel. We got to run this thing back. And so today we're going to be talking about the scope of practice.
okay.
This is a conversation amongst conversations.
This is a challenge.
Why is it a challenge today? Let's talk about that.
Because there are a lot of emotions connected to this, a lot identity, a lot of sometimes pride, sometimes shame, depending on which end of it you're on. And, I'm going to say this from the beginning. I think that our governing boards have not handled this appropriately, effectively, consistently. And because of that, all of the chaos trickles down. And who gets hurt the most? The consumer.
Yeah, the clients.
The clients.
They're the ones
the
not being
people.
served well.
That's right.
They're the ones getting the short end of the stick. They're the ones in confusion. Do I see LMFT? Do I see psychologist? Do I need a coach? Is it the pastor I need to sit with? They're looking for solutions, and there's no real clarity to who serves who and who does what.
And how much?
And how much? Do they overlap?
Mhm.
And so I hear you talking about the governing body. Can we talk even in that? There are some people that are like, what governing body is she talking about?
That's
So
right.
can you clarify even that?
So there's the Board of Behavioral Sciences, that's the BBS. And then there's the Board of Psychology, which is the BOP, which is, directly under the governor, and they are not clear. So psychologists are I believe we're the only profession that's under the Board of Psychology.
Okay.
Okay. Everyone else that works in the field of psychology is under the BBS.
Correct.
And
Let's identify what those other roles are.
so the other roles are to be, if you're licensed and you're practicing, then you are a licensed marriage and family therapist. You are a licensed clinical social worker or a licensed social worker. You can be a licensed professional clinical counselor, LPCC. I always have to watch that one. I think that's it for license.
So like
Is
the
that
social
it?
workers, MFT.
And the licensed professional
That is correct.
clinical counselor.
LPCC.
Yeah, those are way in which you can see a therapist that is licensed, and you should only be going to licensed therapists for therapy. And of course, psychologists who are licensed. And the interesting thing is psychologists are licensed to do everything. Oh, I mentioned, well, they're not under the Board of Psychology, but where this all started and the people that we should all be thankful to is psychiatrists.
I was going to say psychiatrists.
Because they are the real.
They are the original.
They are the original, right? And they have been allocated more to prescribing medications. And because there's so much to be done in that, that's pretty much what they focus on. But psychiatrists can do therapy. Psychiatrists can do any and everything if they chose to. But they make so much money prescribing medication. Why would they want to do?
Well,
the
they
other
add the
things?
additional.
Right.
Right.
And the specialty for psychologists is really more on the assessment, doing testing. And so that's our wheelhouse. But we are licensed, and here we're talking about California, so let's stick with California. We are licensed in the state of California to do all of it except prescribing medication.
Which is what the psychiatrist does.
Which is what the psychiatrist.
So when we if we're looking at a chart, right? Let's just pretend we have a chart here. We have psychiatrists at the very top of that chart, and they are able to do everything that they do, prescribing medication. And then you have the psychologist
Mm-hmm.
who, again, they can't prescribe medication, but they can do everything
Right.
else.
And actually, I want to make a clarification because I just remembered that psychologists can go back to school for some additional psychopharmacology and prescribe. So that is an avenue in which they can go if they want to. So
For some additional schooling
for additional training,
to have that
yeah,
emphasis.
to have that emphasis, and they can be certified to do that.
Okay, that's good to know.
Yeah, it is.
So at this point, we got the psychiatrist,
Mm-hmm.
we got the psychologist.
Mm-hmm.
Now, underneath that, we would have the licensed marriage family therapist.
Right. So I want to go back to why that hierarchy is there so that people understand. So in education there is, you go to school, you get a high school diploma. That's the beginning, right? Or you can get a GED, but you have to complete your general studies under a high school level, right?
Yep.
From high school level, it's the associate.
The associate.
Right? 2-year degree, associate degree. After that, it's a 4-year degree.
Correct.
And we call that a bachelor, right?
Correct.
After that, it's 2 or 3 more years, and that's the master's degree.
Correct.
Right? After that, a few more years, 3 minimum, and that's a doctorate degree.
That is correct.
Right?
That is correct.
And if you choose, you can go a different route from the bachelor and master level. You can go from bachelor, work your way into the medical field,
Which is
right?
PhD.
Which is a doctor, an MD, right? And the psychiatrist went the medical route, a medical doctor. A psychiatrist is a medical doctor.
Correct.
Okay. A psychologist went up the rung, got their PhD or PsyD, and they are a doctor level, right? But you can have a PhD or a PsyD and you're not a psychologist. I want to make that very clear. You can have a PhD, you can have a PsyD, and you're not a psychologist. Or you can have a doctor of education. You're not a doctor of education in psychology. You are not a psychologist. Okay.
You just have a
You have
doctorate
a
degree.
doctorate degree in psychology. All right.
That is correct.
You are not a psychologist in the state of California until you meet the requirements, sit before the board, pass the law and ethics exam, and then you get your license number. Now you're a psychologist.
Correct.
That's the only way in the state of California you can call yourself a psychologist. I want to make that very clear because there's a lot of people out there calling themselves psychologists and they don't have a license number, or their license number is at the master's level and they have a PhD, but you look at where the license is, and if the license is under an LMFT, an LCSW, or an LPCC, then that they are practicing at the master's level, even though they may have some additional training that gave them a doctorate degree. They can go work in a university as a doctor.
Or teach or professor.
That's what I mean.
Yeah.
Work in a university
Right.
as teaching as a doctor. But that teaching as a doctor, if they don't have a license as a doctor, they're not a psychologist teaching you in that classroom. They are a professor, right? And that's fine.
Absolutely. And the reason why I say that is because there are tons of people who do not have that clarity, right? You have the doctorate degree, but you're licensed in something that is on a master level, which is a lower level.
That's it.
It is what it is,
It
right?
is
This is what you did.
Master,
right?
doctor.
But having that doctorate does empower you to do more things, right? So if
Right.
you're an LMFT
Mhm.
and you are licensed as an LMFT and you have a doctorate degree,
Mhm.
right? You are able to be a professor at a college,
Right.
which most universities do require that.
Right.
So
And some universities require you to be licensed at
Some
the
do.
doctoral level.
absolutely.
So just
And
FYI.
depending, and that's something you definitely, and we're having this conversation because there are a ton of us that are going back to school
Mhm.
and we're choosing. And I personally, even when I decided to go back,
Mhm.
I had to give you a call and I said, listen, there's tons of programs out here. How do I know which program to choose?
Absolutely.
How do I know what is going to be best for me in my career? Because there's a heavy, heavy investment called
Yeah.
3,000 hours
Yes.
of free labor.
Yes. Yes. Ooh,
And
child.
before I give up these 3,000 hours of free labor,
Not to mention
not
the
even the
costs.
education, the cost, yes. But we are willing to sit through the classes. We are willing to do the work. But when we have to give up 3,000 hours of free labor, you better make sure you're in the right program.
That's true.
Because it is going to take quite a bit of time to get through those hours.
That's right.
Even if you did it as a full-time job, which most people don't do it as a full-time job.
Right.
But even if you did, it would still take years to get that done.
Right. And even if you were lucky enough to get employed by an agency who would be paying you something, that's still, you're still not going to be paid at the level that you would once you're licensed.
Right. And so we are having this conversation. We see younger people going to these levels, right?
Mhm.
They're doing it faster,
Mhm.
right?
Yeah. Oh, way faster.
I have a little bit of a challenge with that.
I agree with you.
I have a challenge with that because a lot of times that doctorate level also came with wisdom, a lived experience, wisdom that you were able to connect certain things, right?
Absolutely.
And so we are
Oh,
now
that's so good.
seeing, and again, this is progress because we are seeing individuals, especially like people that I'm around. I know people with their doctorates at 24. Easy. 24 years old with a doctorate. I am not knocking it in any way, but I am saying that there are some challenges that come with that.
You're absolutely
Right.
right.
Especially if you are in a program, marriage family therapy. Right. So you are sitting with families and you may not have that.
You have no experience.
You don't have the experience yet.
You may not even be married yet. You may not have had any children. You may not have had the challenges that go with being partnered with someone and, the family dynamics, just things that would help if you are counseling a family who's going through all of that.
Right.
Or having problems with their teenager, and you're just a few years out from that.
Now you may have some better insight though too, and if
That's true.
let's.
But how are you dealing with the parents?
Correct.
Right?
The
Because you
parents
may
may be
have the
struggling.
teen perspective,
Correct.
but do you
Because
have
you're closer to that age.
exactly?
I may have forgotten what it was like to, and so in some regards, I can see the progression of these degrees being earned because they are being earned.
Mhm.
They are working hard. They are
Mhm.
doing they're doing all the things.
Yeah.
But there still is an applied wisdom that is needed in these areas. And so
That's one reason why a lot of people that are now older and going back, they are such a rich commodity because they do have that. What they lack is confidence because they don't understand the language anymore. It's difficult. They have to reread. They have to concentrate harder. But if they're able to get past that, the field would love to have you. I want to just say that again. If you are older and you're thinking, man, that would have been nice, or when you were younger, you thought, wow, I wish I'd, gone into that, and now you're older, I would just say, if that is a passion, if that's something you want to do, please consider it because the field needs your wisdom, your experience. They can give you the education, but they can't always give you the wisdom and the experience.
And that's the truth. That is the cross that we bear. Right? You got young, vibrant, confident, hardworking, diligent young people going out and getting their doctorate degrees younger than we've ever seen before.
That is true.
Their challenge is experience.
And you know what? I wanna add to that. Those that are doing it and understand that
Are fine
and humble themselves, they're great.
because they tend to do what I did is get a mentor.
And they're open to learning. They're open to correction. They're open
They're
to
coachable.
coaching. Right.
Right.
Right. And so we welcome that. I don't want to make it sound like that, we're only looking for older people and, younger people can't be as valuable because
They
what
are.
you said is really, really
Absolutely.
true. I think on both sides, and that's what we're talking about today,
Yeah.
scope of practice and knowing where your limits are, right?
Yep.
And recognizing that and getting help and support with those limits.
Absolutely. And so just like someone who is older choosing to go back Black, they have their own barriers.
Yeah, absolutely.
Right?
Absolutely.
They
They
have
have to
their
be
own challenges.
open-minded because they have to change.
They have to change. They have to be open-minded, right? They have to be willing to learn the new, right? Because cultures have changed.
Cultures have changed.
Culture has changed. And things don't even operate in the same capacity. You know, I think about if you are a LMFT and you are over 60, let's say over 60,
Okay.
and you're seeing a client that is talking about the dating apps. If you don't connect with those dating apps,
That's true.
there's going to be a disconnect.
That's true.
So
But you know what? I want to say a lot of that has to do with your training program.
It does.
Right? Your training program is so one of the things that have always stuck with me from my training program is that we're being trained to be the vessel that the consumer or the client patient uses for change. We are the vessel that is used for change. And when you get that in your knower and understanding, that means you've got to change
consistently.
You've got to be flexible, you've got to be moldable because they're coming to you and they need to use you for that change. And I don't know what that might sound like or what you might think that looks like, but one is, for example, if someone comes to you now as a psychologist, we're trained in all modalities. We're trained in all demographics, right? And it's just like anything else. You can specialize in a particular thing. I specialize in racial challenges, right? I specialize in multicultural presentations and demographics because that's what I choose to put all of my emphasis and time in. But as a psychologist, I could choose anything, which is wonderful, right? I may need to go back and get some additional training, some more CEs, some consultation, right? Work under someone to observe me so that I make sure that I'm, doing the best job under that. But my license says that as a psychologist, I can work in any area that deals with psychology. That means that as a doctor, the doctor is the highest you can go in a field. As a doctor, in psychology, I've reached the pinnacle of what psychology training offers. Now, I can specialize in something, and that increases my knowledge, and our CEs are supposed to increase our general knowledge so that every 2 years I have to recertify that I am current in the things that my license says that I should know.
Absolutely. Absolutely. And because of that, and so I was just thinking about it because we're talking about the psychiatrist and then the psychologist and then the LMFT and then you got the coaches and then, well, we're going to put the pastor over the coach.
Okay, good.
Because I often we see people who are going, who may be having some mental health challenges, and instead of going to one of the clinicians, they go to their pastor. And I'm like, he is a pastor.
Scope of practice.
Theology.
Scope of practice.
Scope of practice. You may be comfortable with him, although that is not the right individual to go see if you're having those challenges.
I totally agree. I think that could be a starting place because you might feel comfortable enough to talk about certain things with your pastor. I think that that's wonderful. I think all of this is needed in our society and our community, all of it, right? But you go to your pastor and you're saying, I have suicidal thoughts. Maybe a loved one gets you to go to the pastor because you're not getting out of bed, you're isolating, you're not eating, you're losing weight, da 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 da. You go to the pastor and he sees you, or the pastor in a lot of situations, the pastor will come to you, which is not something that we typically do. So the pastor will come to you, sees you in the bed, sees you, da 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 da. Yeah, I can offer to pray for you, and then we need to get you some help.
We need to get you
Right?
some help.
And to recognize this is outside of my scope of practice. And so let's get you to someone that can help you. If he came to see you and your bone was sticking out of your leg,
He would call an ambulance.
he would call an ambulance and get you the right services that you need,
And
right?
that is
And the same thing goes for the mind. And to realize he's not going to sit there and try and patch up your knee and say it's all right, or your leg and says it's all right. He's going to say, no, this is outside my scope of practice. I need to get you some help that is specific for that.
but you need attention.
And you need attention,
You
for
need
sure.
attention. And I love that you said that because we only see this in mental health. In other areas,
So true.
in other areas, people stay in their roles. They know their lanes. But when it
Wow.
comes to mental health, everybody thinks they can do it.
Wow. That is such a really good.
I've thought about this for quite a while, and I'm like, why is it's only in mental health that you see this?
That is so true.
And that's where I often say the coaches cross those lines as well,
Mm-hmm.
right? And
Mhm.
so I want to talk about you've communicated what the psychiatrist does. You've talked about what the psychologist does.
Mhm.
Let's talk about what the MFT does. The
Okay.
licensed MFT.
Okay. Ooh, you know what? I know I'm gonna get people probably throwing things at their TV at this point or their screen, whatever they're viewing it from. So I am not an LMFT. So I'm giving that caveat that I'm willing to have missed the boat somewhat on this. I just have to start with it's a master's degree. It's a master level, and that should mean something. Okay. LMFT. Now, I've heard recently that things have expanded. I'm in the field and I didn't know. I think that, again, there's some lack of consumer information for it to be so complicated. LMFT means Licensed Marriage and Family Therapy. Now, when I came in the field, which wasn't that long ago, marriage and family systems is based on dyads. Marriage is usually two people. Family is usually two people plus. I mean, this
That
is
is correct.
basics.
It's basics.
Okay.
Marriage,
And it means
family.
that they are really good with focusing on interpersonal relationships and family dynamics, right? So
Family
you've got
systems.
two people or more that are not getting along. So you go to someone who is trained to be able to listen, to be able to process what's happening from a neutral perspective and can offer suggestions, interventions, homework, things for you all to do to work together. Now, while you're in this LMFT environment, you are working with this family or this couple, and you notice that one of the members is every now and again you look and you're like, wonder what that's about. Or they're as if they're seeing something
Mhm.
or talking to
Or
something
responding to.
or responding to something that's not there.
Mhm.
Okay. You're still working with this couple, but you're noticing that, right? That person I just in general, they may be exhibiting psychosis, right?
Correct.
What I mean is they may be having some visual or auditory hallucinations, right? At that point, that LMFT is not trained to deal with that individual situation. That person needs to be referred out.
Absolutely.
Okay. And they need to be referred to a licensed clinical psychologist
Correct.
or the psychiatrist.
Or the psychiatrist.
Right?
It has to go up the chain.
It has to go up the chain.
It gotta go up the
It's
chain.
got to go up the chain.
So up the chain,
Up the chain, right?
the psychologist
that's scope of
or the
practice.
that is scope of practice.
That's the scope of practice. Okay. Now
That
back
is
to
scope of
the
practice.
family. Now they can still continue to work with the family as long as that person is getting help, because otherwise that person now may be interfering with the family system,
Mhm.
and that family system is not going to be able to function appropriately until that person gets help. So either that person for a season steps out of the family system and working with the LMFT, and now they are going to get their help. The family's going to continue to work. And then when that person is stable, and stable means that, maybe they've got on some medication and now they're not entertaining this
At risk
psychosis
or at risk.
and not at risk. And now they are able to join back with the family therapy.
Correct.
That is what I understand the process to look like.
That is what we have operated on. That is what the process should look like. That person should be referred out to get services, and then they can be filtered back in once that has been resolved or come to some, maybe not resolved, stabilization is the word that I want to use.
Mhm.
When they have become stable, then they can be filtered back in and they can resume because that other challenge is still there.
It's still there.
still
and
there.
They need to work within the family system, but there's something individually happening with them that needs to be addressed. It's the same thing with marriage, right? Or
Right.
couples, because an LMFT can still do
Correct.
that, right? And they're working with two people, and then one of the people in the couple, you recognize that their part of their issue is that they have borderline personality
Mhm.
disorder. Okay, that can definitely interfere with interpersonal relationship. Okay, and
Untreated, undiagnosed.
untreated and undiagnosed. And so that person needs to be referred out, because these are what was considered individual therapy challenges that go beyond that person as an LMFT scope of practice.
That is correct.
But I see it happening all the time.
We see it every day.
And that is the concern. And the consumer don't know how to tell the difference.
They do, because some professionals don't know how to tell the difference, right? And you got, and again, let's go back to what you said from the very beginning. We're talking about the governing body. That's one challenge, right? Then you got the school level. That's another challenge, because there's so many different programs that look and sound the same.
That's right.
How do I know which one I want to do?
That's right.
How do I know which one am I going to be able to function in my purpose, in my calling, in my passion? Which one of these are going to allow me to do it? It's like a chart. You're looking, you're like, how far is this one going to let me go? And how far is this one going to let me go? And I just had this scenario myself. As I decided to go back to school, I was challenged to identify which program was the right fit for me. And I had to go, and I talked to several. You were one of them. I talked to two others that were on the doctorate level in different areas. I wanted to talk to people in different areas to identify what I wanted to do. I was clear I did not want to do what you were doing. And no, because I know me, right? And so I understood me enough to know that that wasn't a good fit for me.
Too much work.
It wasn't a good fit for me.
Too many years. Too many years.
Even just the scope of practice as well, right?
True.
The scope of practice as
That is
well.
true. That's
I have
true.
a heart, I have a passion for working with couples and families.
Right.
So that's why it wasn't a good fit for me.
Okay.
And that's okay. I want, you can still do that. I knew you were gonna say that. Look, because it doesn't limit me. But here's the thing: I also didn't want to do what you do, right?
So that's why I have to keep going back to the hours and the time and the da, because I could still work. I could have a practice with nothing but family
Correct.
and couples.
Right.
Right. I can do that, and where you would be
Correct.
doing that and limiting yourself to just that, or
Correct.
to mostly just that.
Correct.
And that's fine. And that's what you're saying, is that I don't have the desire to do the individual at the level that I'm doing it. So why go through all of that?
Why
that I understand.
Yes. But I'll be honest with you, when I was going through school previously, that wasn't clear.
Okay. I agree.
That wasn't clear.
Yeah.
Right? I just knew, and and let me just say this. When I went back to school for the first degree, I remember talking to the counselor, and I said, I just want to help people.
Okay.
And she said to me, you are a human service worker. Get your AA degree in human services.
Wow.
So I have an AA degree in human services because that's what she told me, because I told her. Now that I know what I know today, she should have never said that to me.
She should have asked you more questions.
She should have asked me more questions, but that wasn't what she did.
No.
And that's okay. I mean,
And
I'm
that
grateful.
could have been her level of understanding.
Absolutely.
Right? That
Absolutely.
was her limited understanding of this is where you should go. Not finding out really what did you mean by that?
What was the end goal? What she
What
should
did
have
you
wanted.
mean by that? I just want to help people. To what end?
You can help people in multiple ways.
Right.
I could be a hairstylist and help
Right.
people.
Exactly.
Because I love my hairstylist. She helps me all the
Right.
So she helped me.
Right.
So she did not, there was no clarity.
Right.
And I didn't know enough to even ask more questions, right? I was the first generation going to college out of my family.
But technically, if she's acting as a counselor,
Correct.
it was her job to know more.
You're absolutely right. And we
to
find
know what questions to ask.
and we're also finding ourselves the same place, even deeper right now, because you have so many programs that look exactly the same, right? Even as I was going through this process just recently, I've only been in school since March. right? So this is a very recent scenario
Right.
where I was asking these questions.
And you did a good job, but not and you had access to resources. You knew a lot of people.
Yes.
So you chose to ask a lot of different people. Most people don't have that access either.
That's why we're having this conversation,
Yeah.
because I understood that everybody doesn't have therapists at their disposal. I mean, outside of I want to book a session,
Right.
but that can sit here and say, okay, let's talk about this.
Right.
Or doctors
Mhm.
or practicing
Mhm.
clinicians. Everybody doesn't have that.
That's true.
And they're going to school younger.
That's true. And they need more guidance and there's less.
You need even more guidance,
Mhm.
right? Because there's some gaps that
Mhm.
you haven't. There's some bridges you ain't crossed yet.
Right. And there's some programs. Let's talk about that. There's some programs that are not functioning ethically, as in my opinion, by
Absolutely.
not providing you with a full understanding rather than just trying to get you in their program.
And you know why? How we have evidence of that? The borrower's defense. They're giving back a whole lot of money.
That's true.
They're giving back a whole lot of money, wiping out a whole lot of loans, not because they were ethical, but because they were unethical in their
That's true.
programming.
That's
Because
true.
they were not actually equipping people properly.
That's
They
true.
were actually not giving the information. So we
And
got
they
the
were
proof.
charging them astronomical amounts. And then at the end, then, many of them not being able to follow through with earning the income that was suggested.
That happened to me in my bachelor's program. So I have an emphasis in correctional program support. Knock it off.
Wow.
Knock it
Sorry.
off.
Wow. That's so wrong.
That's so wrong.
I'm sorry.
Correctional program support. What
does
is that?
mean?
What does it mean? What does it mean?
Support you.
Ask me how much more did I pay for that.
Oh,
I'm not ready to talk about it. I do believe that all things work together for my good. So in that program, one of the things that they emphasized on is grant writing.
Oh, cool. There you go.
So
There you go. That supports you now.
it worked for me today.
Yeah.
What was meant for evil.
That's it. It's evil.
It feels like it today, as I can't apply to anything because I have that emphasis.
Wow.
But no,
the honest.
that's the honest to God truth. That I'm
so
laughing
true.
about it today, but I
Right.
was not laughing about it when I figured out that I had been upsold in my education.
Yeah.
I was being upsold.
Wow.
Okay,
Wow.
that's the truth.
Wow. That's that.
I was upsold, and so that is
That's
what we're
kinda
dealing with.
That's kind of like how I'm starting to feel. And I have a license in clinical psychology.
Yeah.
But when people that have a master's level that are now challenging my position at the doctoral level, and I'm thinking, if that would be the case, why did I go through all of this training and all of this debt and all of the blood, sweat, and tears and the thesis and the dissertation and the years of research and all of the clinical hours and the sacrifice and draining your savings account and just the sacrifice in your personal life, the not being able to attend family functions and to do family vacations and all of that because you're constantly studying and preparing. Why would I go through all of that if I could have done it at the master's level?
And you know that, again, it's systemic. We know that. But it's challenging because all of that is why you are the level of clinician you are, right? Listen, I'm not mad that you did it.
Well,
Because I'm not mad that you did it. I am challenged that they're not requiring it as much as they did.
And you mentioned something earlier about time in service, right?
Mhm.
Not just life experience, because that does play a big part, but time in service. Like, in order for you to, I went the long route.
Mhm.
Even though I went through an accelerated program, I did way more than my 3,000 hours.
Okay.
Okay. We were laughing because I was saying I worked in-home therapy for almost 2 years.
Mhm.
That was something, right? I went all over the county of San Diego. I went from San Ysidro, which is the southernest part,
Most southern.
right?
Before Mexico.
Right, to Fallbrook and Vista, that's the northernest,
Mhm.
to Santee and El Cajon, that's the eastern,
Mhm.
to Carlsbad and Oceanside, that's the west,
Yeah.
and Del Mar and all of that, and everything in between. I didn't know San Diego from nothing. I moved down here, had been here, and And I know all of San Diego because of that. And I didn't get paid one dime. And I used all of my own gas, my car, all of that. That was part of the paying my dues. I worked for 2 years in HIV specific homes, right? I was the only clinician for 2 homes. And I worked with all different kinds of demographics. I worked in a lockdown facility for a year, right? Where I only saw psychosis, right? So my training was in depth. So when somebody come to my office and they are experiencing psychosis, I'm not upset.
Right.
I'm not scared, right? I know what to do. I have been in a situation where I was not safe, but my training kicked in and I knew what to do, right? So these things take time. I started the program and it took me 10 years before I got licensed. From start to finish, it was 10 years. Invaluable training. It wasn't just the academics. It was invaluable experiential training under licensed clinical psychologists. And that has to stand for something.
And the accountability and the guidance, and you need that.
Yes.
It's needed.
Yes.
That's why we have so many errors. Ethical, right? Let's talk about it. There's a lot of people having physical relationships with people that they saw.
Oh.
It happens. You know it happens a lot.
Psychotherapy does not mean sex. That is a handbook. Psychotherapy does not mean sex.
We talked about this not too long ago, that they can't even handle the emotional connection.
I have been, so this is a funny, I have been hit on by everyone, okay? And it's a natural part of the process because people are being honest with you. They're being vulnerable with you. They're sharing things that they've never shared with anybody. Of course, they're going to feel connected to you. Our program tells us and teaches us that is normal. That is normal, okay? And so when someone approaches you like that, you have to understand they don't really mean that.
No.
I don't care what it looks like.
Correct.
They really don't mean they want to have sex with you.
No.
So don't open that door for them. What it means is I want to feel safe with you. You show them, you model to them how to be in relationship without violating them.
Absolutely.
How dare you? How dare you? Someone is coming to you in their most vulnerable state and you abuse them by using them? That is the epitome. I'm sorry I get a little passionate about that.
I need you to be passionate about it because
so wrong.
It is so wrong. And
I don't care what gender identity you are.
No.
I have been hit on by everything and it's still wrong. I am not your girlfriend, your boyfriend, your sister, your mother, your friend. I am none of that. I am your therapist. I am a safe space for you. And when I'm not, then it's time for us to part our ways and you be referred out to someone because that is an important, and I've had to do that. With people that just want to have that more intimate relationship with me, it is my job to protect you from even me.
Absolutely.
So no.
Absolutely.
No, absolutely not.
And we're seeing it. We see it all over the place. And I just wrote a paper 2 weeks ago on ethical boundaries. And I'll be honest, and I said this to you before, that the way that I'm going through school now versus the first time is completely different.
Wow.
Oh, I'm having a completely different experience. Absolutely completely different, where I have a picture to put to the work. So as I'm reading these case studies, I've seen this over here. As I'm reading the boundaries that need to be placed, I had to put some boundaries in place.
Right.
So now I have a better understanding of what healthy boundaries look like. Not because I read it in a book, but I actually had to implement it in my marriage.
Right.
And so now I could connect that experience with the education. And I agree with you. I know that I am going to be a much better.
Yeah.
Right? But there's a lot of people who don't have that,
No,
right?
they don't. And I worry about that because, whether they're young or old,
Either way. Either way, because they both have barriers.
That's right.
Which is why we wanted to have this conversation, because when you notice and know that you have a barrier, when you know forget what the board says, because it has to come on an individual level first.
And you have to be honest, right?
You
The
have to
board,
be
the board
honest.
only knows what you share with them or what someone else shares with them. That doesn't necessarily have to be true or not. So it always comes back to your personal efficacy and ethics, your personal willingness to be honest with yourself.
To be honest with you first.
Yes, yes. And an example of this, and it hits deep. When I was going through problems in my marriage, I was in leadership, at my church. And even then, and this was way before I had any thought of going back to school, period, or going into the field of psychology. And my ethical boundaries were already established in who I am, my character. And so when I was going through those issues, I went to my authority and I removed myself from that place of leadership because I felt like it was not appropriate for me to be in that position going through what I was going through.
Okay.
Right? That's on me. They didn't have to know anything about what was happening.
Right.
Right? And they didn't. I could have continued.
Could have walked
right?
in, blessed and highly favored every week.
There you go. Okay. But I didn't, and I removed myself. And, and then when I felt it was time and I had, done my work and prayed and was in a position to be restored, right? And we're talking a year later, they refused to reinstate me, right? So there is that. But I really do believe that it is an individual conviction that should happen. That when you know that there's things going on in your life, take a step back. I've done that since I've been in practice. I've had situations come up and I knew I couldn't give my patients the best or my clients the best. And so I stepped back. It is incumbent upon people to realize their responsibility when it comes to helping the consumer, helping the individual that's sitting across from you, helping our community, and being healthy and ready and putting their lives first. You were talking about that earlier, that our job is to do the best for the consumer.
Absolutely.
And that's my hope, that in these conversations, these wonderful talks that we're having, that people will become educated, they will become informed, they will become empowered. That's my word, empowered to make informed decisions.
Yeah.
Right? With understanding and knowledge, and not be just, oh, somebody said go see a therapist. And most of the people that come to me, I ask them, have you ever had therapy? They said, yeah. I said, what was the credentials of your therapist? They were a therapist. No, what was their credentials? I don't know. They were a therapist.
They don't know the difference, which is why we're having this conversation, because they do not know that they absolutely.
And I'm telling you, after some conversations I've had recently, I'm wondering if I know the difference. Jeez.
And listen, anywhere you see anything that has Sharon Gilmore, it says coach, right? Everywhere it says coach. I can't tell you how many people come to me and say, you're a therapist. And I said, no, I have this education, but I'm a coach. And
you are so rare.
It's very complicated. And I'll be honest, it is confusing. It is confusing because.
Especially when you refer them out.
Especially when I refer them out.
Many to me. And they're like, well,
why can't I see you? I want to see you, right? Many of them say, I want to see you. You're knowledgeable. Something you said to me is why I want to see you.
And that's why you went back to school.
And so that's why I'm going back to school, because I'm trying to turn them over.
There you go.
That's good. But that's the right way to handle it.
That is the right way.
If you're a coach and you know that, you know what, I want to do more, I want to see more.
Right.
Maybe you have the lived experience that are connecting with people on a higher level, but you don't have the academia. You cannot.
Ethically, you
right?
cannot.
And you have to refer them out. And we all should be taking this oath to prioritize the care of our clients, right?
Clients. That's right.
We have to prioritize their care. And so one of my challenges, and I'm going to be honest, it's not even just in the hierarchy. I've seen therapists, marriage family therapists, see individuals that they were not a good fit for.
Yeah.
It's within your scope,
Mhm.
but you're just not the best fit for
I've
them.
had that. I've had that.
You're just not the best fit for them.
Yeah.
And now you're wrestling with this client,
Yeah.
frustrating them.
Yeah.
They're losing hope.
Yeah. Oh, ouch. Yes. And now they're going to leave you, and then they're going to be done with therapy
And they're going to be done
altogether.
with therapy
Where
altogether.
in the beginning you should have said, you know what? Are you feeling this like I'm feeling? Maybe we're just not a good fit. I don't want you to lose hope in therapy. I want to refer you out and try that. That's what we should be doing. And
That's
I've
what
referred
should
a
be
lot of
happening.
people
I've
out.
referred a ton of people
Right.
as a coach.
Yeah.
And they're comfortable with me. They
Mhm.
like me.
Mhm.
Some of them have been prominent.
Mhm.
Some of them not.
Mhm.
I don't care the difference. It
Mhm.
doesn't matter to me. I am going to follow my scope of practice,
Right.
and I hold myself accountable, right? And so I have people like you in my life.
Mhm.
So when I come up against something, and we've had this conversation multiple times, where
Mhm.
I've said, you know what, can I run this case past you, this family or this individual? What do you think about this?
Mhm.
And there's been times when you've said to me,
That's beyond your scope of.
that's beyond your scope of practice. And there's nothing wrong with finding that out.
Mhm.
And I want to admit that because there's some coaches out there or some
Mhm.
LMFTs
Mhm.
out there,
Mhm.
right, that
Or
are
LCSW.
LCSWs
Mhm.
or LPCCs who are seeing people and it's beyond your scope.
Mhm.
And the best thing to do is to refer them up.
Mhm.
Right? Is to refer them up and say, this, and maybe you don't have anybody to refer them to,
Oh, there's so many resources now
but there's so many resources, right? And we should keep those resources handy
That's right.
to be able to connect them.
Right. Psychology Today is an excellent source and free but to that point as well, there are some psychologists that not all psychologists are created equal either.
Come on.
Right?
Yes.
And sometimes they're not a good fit, right? And
I've faced some horrifying
that's right.
diagnosis
And so I want to speak to misdiagnosis
because they happen.
because it happens all the time. I've misdiagnosed. So it's not the misdiagnosis that's really as much the key as what do you do with that, right? Something like that to begin with takes time to even diagnose. We're talking about provisional diagnoses versus rule outs versus all of that, right? And
It was a one and done,
no,
which is obviously
that even points to there's a problem there, right? Because that is historically, within the in the model for treatment, you have to get a real history. Is there anyone else in your family that has a mood disorder? Mainly mom or dad.
Not my third cousin,
Mainly mom and dad. That's where that's where you're generally gonna look. You're gonna look at is this the first episode? What was the symptoms? Now just going back and forth.
because she was having a very difficult time about the boyfriend being a good guy and wanting to, and then him taking her time and not. It was
It has
typical.
nothing
It was
to
very
do with
no, it did not.
full-blown mood
It did
disorder.
not, and it
And
was.
once you label someone
You took the words. So this is where the mom was very
insistent that,
aware
yeah,
and advocated well
yeah,
because she understood that was being now
right,
documented on her
right,
on her medical chart.
right. No, so wise
Which,
mom, good kudos
and
to you.
I'm bringing this up
Yeah,
because not to make it seem like, oh, you shouldn't go
right,
get help, but these things
right.
happen. And what do you do
Mhm.
if you feel like you have saw someone
Second
and
opinion,
second opinion,
And
and a
the
third
other
if you
thing,
need?
especially if they're young, the other thing that masks itself sometimes looking like a mood disorder is ADHD. And so that is very different as well. So, and they can be co-occurring. You can have, both.
Multiple, yes.
Right. But even in that part,
It's
you
still
really
over a series.
it's really that gets complicated, overlapping diagnosis, co-occurring that's more complicated. And the more it's just like anything else. The more you add to it, the higher the degree needs to be, right? So, you start having as an older adult, you start having more problems. You need an internist to monitor all of this, not just your cardiology that deals with your heart or your rheumatologist that deals with thyroid issues and all of that, or nephrologist. You see what I mean?
Absolutely.
So
That's why they have specialties.
right. And
That is the purpose of
so that's
specialties.
right. And so you should really go to someone who specializes in those areas because once you start getting into that, co-occurring disorders are very, very common for a mood disorder, an anxiety disorder, and trauma.
Absolutely. Last thing I want to cover are coaches. What is the scope of practice for a coach?
You know what? I am so glad you said that. I have been on a discovery this last year, and
Mhm.
it has been so good. I'm so grateful. And I'm so grateful to have met you and understand what you do, and it has really helped to broaden my understanding. Let me also mention the difference between when I interchange the word patient and the word client, okay? When you work with someone outside of a hospital environment, they are considered a client. When you work with someone that's in a hospital environment, they are considered a patient. Okay. I use words interchangeably because many of my patients are chronic mental health people with chronic mental health. I need to correct my verbiage here. They're people with chronic mental health conditions. Okay. And that means they more than likely are on psychotropic medications prescribed by a psychiatrist, hopefully, or their primary care physician. And so, because of that, we are interchanging information. We are working as a team together. And because of that, they are not just my client now, they're my patient because we are talking professional to professional about the same person. That person now is my patient, not just my client. Okay, so that's why I use it interchangeably. But for people that come in, they never need any psychotropic medication. We're doing mostly just talk therapy. And they have some specific goals regarding their mental health that they need taken care of. We accomplish that goal, they're my client. Once they accomplish that goal, maybe it's that they were having some super anxiety about a decision they needed to make, or they lost a loved one, or something like that, and they were really having psychological distress. Okay. They're my client, all right? And now we've gotten to the point where they're stable. They're no longer isolating. They're no longer doing some of the things that warrant them to need psychological support. However, now that they're doing well, they have some logistic issues.
Mhm.
Maybe they're not reaching their goals. They're not reaching their potential and they feel stuck in that area, but psychologically they're great. That's when I would refer them to a coach, okay? Because now they've got some goals that they need to work on. They're stable psychologically, and now they're able to work on those goals. They're not stuck anymore.
Mhm.
In psychologically. They may
Right.
be stuck just lacking their motivation
Right.
or lacking
Completing your goal,
completing the goal. That's what a coach is
getting an
for.
outcome.
Right, to help them. And there are so many reasons to use a coach. And now I'm starting to refer people because when they get done, I realize that I'm just kind of dropping them off. Well, until the next time you have some
And that's what
issues,
happens.
come to me. But they may not now that they're clear headed, now they're like, oh man, where am I going? And the coach would be great for that.
Absolutely.
And so now we're learning how to work together.
How do we
And
work
all
together?
of those,
Integrated.
all of the other LMFT, LPCC, and LCSWs, we've got to learn how to find our scope of practice, work within that, and refer one another.
And can we work together?
Can we work together?
Can we play together and work
Can we
together?
work together?
And
Can
that's
we
the
all
thing.
get along?
It is. Can we all get along for the sake of the client?
Yes, and they would be so much better. And you know what? You don't have to say, because going to a psychologist is not cheap. So why do you need to work through some of those motivational skills that a coach can do for more reasonable amount? And that's the thing.
That is the thing. We have the levels. This thing goes all the way up.
Yes, it
And
does.
it's like you can go to a hairstylist and not need a colorist.
But a hairstylist that's a colorist, they're gonna get a little bit more.
They're gonna get a little bit more because they're into the science of it.
There you go.
Right?
There you go.
And I know this because I have a colorist
Okay,
at my house.
okay, okay.
And she's like, oh, let me see. Your hair is completely different
Okay.
from the young lady that just braids my hair.
Okay.
Okay. And so it really depends on where you are, what you need. Now,
Okay.
and I see all of them at different times.
Okay.
Right? So a client that can sit with you
Mhm.
and they get what they need over there,
And
and
they
you
can
can give
sit
them
with you.
homework. And you
Yeah.
can give them homework.
Yeah.
I can actually be the one that helps them with their homework. So I'll give you an
Depending on what
example.
they're-
I'll give you an
well,
example. They'll
I-
see. Okay, let's talk about it. I could be wrong. Correct me if I'm wrong.
Yeah,
I'm
no,
open.
if I'm assigning homework, then that homework needs to come back to me. So
No,
I'm
it
not
needs to come back to
understanding
you.
that.
Absolutely. I'm not saying that.
Okay.
I'm not saying that at all.
Okay.
The homework, the teacher that assigns the homework needs to do the homework.
Okay.
So I'll give you an example.
Okay.
Then you can tell me if I'm right or wrong because
Okay.
I'm open for correction.
Okay.
So you are seeing someone and they're challenged, and part of your homework that you're giving them may be move your body. That might be part of the homework.
Okay.
A part of the homework.
Okay. Gotcha.
Not homework in total,
Gotcha.
but maybe part of it.
I got you.
You went back, the client came back to you.
Mm-hmm.
They're having a challenge. We
I
say
have you. You're absolutely right. I stand corrected.
that's how a clinician and a coach can work
I
together,
stand corrected. You're absolutely right.
right?
Yes.
So the part is she can follow with me about, hey,
I thought you were talking about written homework that I'm
Nope.
prescribing for.
Nope.
Yeah. No, you're
Nope.
absolutely correct.
right?
Yes.
And then there's also, let's talk about the other avenue that we often are talking about is aftercare.
Right.
Okay. Aftercare.
But that's
And I say that because I actually do work with a therapist, right? Who, when she gives particular things,
I agree.
she will hand them off and say, hey, we're working on this.
Yes.
Are you interested in doing a few
That
sessions
is
with
an
them?
excellent
A few
idea.
sessions with them
Yes.
in this area.
I totally agree.
Right. But often what I have seen and experienced is that they will go to the clinician, they will get the help that they need, and afterwards,
Right.
they may come and see me.
Right.
Because now they can move forward
Right.
and
'Cause
the
they're
other
stable.
goals, right? Because it's
Right.
stable now.
Right.
So their anxiety is no longer causing them.
Impeding them
Right.
from doing what they need to do.
Right.
So that's a perfect example. I appreciate that.
So I wanted to give two different.
Yes, because I was like, wait a minute, I ain't gonna
But
let this-
listen, this is a learning environment.
Yeah. Yeah.
And
No, it's good.
I want to learn and grow, and I want our people to learn and grow.
And
And this is right. So this is an opportunity where we can have the conversation, and I'm vulnerable enough. I can be wrong and be corrected,
And so can I.
and we can run with that because that's going to help us really identify who does what.
I think that's an
So
excellent.
the way that I like to talk about coaching, I've had to recently get my wording together better. One, because I'm in school, and two, because of my accountability partner that might be in the room. But I used to always say I like to move people forward, but we all move people forward. But I
That's
like
good.
to help people accomplish goals.
Yes.
I'm very result driven.
And so hear that as she's describing what a coach is, because she is, that's why I refer people to you, because I think you are so good at what you do. That's why I prefer this personal relationship, because you're really good at what you do and you hold the boundary. I don't know many people that hold the boundary as well as you do. And that's why if you can speak for coaches and really help them to understand, I think that goes so far in promoting this field
Holistic,
and holistic approach.
integrated,
Yes.
work together. But it's going to take us together.
Yes.
Clinicians are going to have to say, because here's the thing, you're overworked already anyway.
Oh, Lord.
Listen,
Yes.
why you want all the work?
That's right.
Why do you know?
That's right.
I get the billable hours. I get all the things that'll pay off the loans. No, we're not gonna let none of those be
Not
factors.
letting the consumer suffer.
Correct. None of those can be the factors of whether they stay or refer out.
That's true.
The only factor should be what is in the best interest of the client or in your words, the patient.
Either way.
Either way.
And
But
if they're
again, the
patient,
fact that you say patient, I say client tells us we have our scope of practice understood.
and I
Because
see
they're not a
both.
patient for no, you can do both, but I
Right.
can't do both.
That's true.
So you're never gonna hear me say patient.
That's true.
I'm never gonna say patient because
Right.
I don't got no patience.
Right.
I got clients. You could have patients and clients.
Right.
And that's really what we're talking about in this practice. We want people to understand there's a difference, there's a hierarchy,
Yes.
and it is perfectly fine. There's enough room for all of us.
Mhm.
Trust me, there's enough clients
Mhm.
that need to write a book
Mhm.
and are struggling with that, or maybe they want to communicate better with their husband
Mhm.
because they're snappy.
Mhm.
There's enough of those people out there that I don't have to go and get in your lane to get clients.
That's true. That is so true.
And if we can do that in a way, I think this conversation, like we're moving this conversation forward with just being able to say, if you are a coach, if I had my perfect way, every practice would have a psychiatrist, a psychologist. Sounds like somebody's framework over here.
That's my
No,
goal.
it is your goal, right?
That's right.
I would like for them to have a licensed marriage family therapist. I would like a coach to be in the same building, right?
Yeah.
And I would love someone that handles diet and health, nutrition,
Yeah.
right? Not medical. I don't necessarily want to do medical, but just
approach to
holistic internal medicine, right? When it comes to diet and health.
I agree.
I think
That is my dream for the fountain.
that right there, to be able to go into one place and see who you need on the day that you need to see them.
That's right.
Or the time period, right? Maybe you're seeing with this person, the psychiatrist got you stabilized now. Now you can go, however it needs to happen.
LCSW, like I can see.
Oh, definitely at LA.
Yes,
No, for
I
sure.
can see, and the LPCC. I would love to have the whole kit and caboodle, as they say.
Yeah.
Because all of those different modalities, when they're working in their scope of practice, are needed. And we need to get back to that. There was a time when that was appreciated and honored and valued. And as I was having a conversation earlier, it's not that anymore. And so everybody is crawling and scratching
crabs in a bucket.
like crabs in a bucket. And it's a shame because again, the person that's getting the worst is the consumer because they have no clue. So I hope that this time has helped to bring clarity because that is the goal for us.
That was the goal. And I'm so grateful for you to come and take on such a big, this was a big conversation. Listen, you see I'm wearing my, I had to put on some serious clothing today now.
No, really. Again, I started with the caveat. I end with the caveat disclaimer that I'm sure that I have not probably been the best in describing each of the professional disciplines. My desire is to be respectful and honor each and to have that conversation because the consumer needs to understand it. And if there's any board members for the BBS or the Board of Psychology, I hope you're listening and understand how confusing it has been for not just the consumer, but the participants as well. So the licensees. So anyway,
this was a big conversation that we started because that's all this was. This was an appetizer.
Yes.
But I thank you for the bravery to do that.
Oh.
What I'm gonna do is
I have not seen these questions.
You have not seen them. You don't know nothing.
I don't know anything. Okay.
So here are the 4 options. Psychologist.
Okay, I feel like I'm back in school. Okay.
Licensed marriage family therapist.
Okay.
Life coach.
Okay.
Pastor.
Oh, this is good. Okay.
Okay. There's 4 scenarios.
Okay.
You're gonna tell us which is which.
Okay.
Which the person who the person should see. Who's the best fit for this client?
Okay.
All right, audience. I also want you to participate in this challenge. So based on the information we just went over, now there is no passing or failing, right? This is just, did you grow in knowledge? And so we want you to participate as well. So as I get this first scenario, grab your pen and paper. I want you to comment in the comments, scenario 1, who do you think it is? Is it a psychologist, a licensed marriage family therapist, a life coach, or a pastor? And that will be for the 4 scenarios. So here we go. Are you ready?
Yes, ma'am.
All right. Scenario 1. I've been in a great marriage for 10 years, but lately my spouse and I keep having the same fight over finances. and we can't break the cycle. Who is the best fit?
Licensed marriage and family therapist.
You have the right answer. All right, scenario 2. I want to switch careers, but I keep self-sabotaging every time I get close to making a move. I don't think it's clinical. I just need someone to hold me accountable.
Coach, life coach.
That is correct. Doing a great job.
Thank you.
Scenario number 3. How are you doing, audience? Are you guys getting it right? If you're not, it's okay. This is just a game. Scenario 3. I've had panic attacks for 6 months, and I want to understand if this is generalized anxiety disorder or something else. Please get some testing done.
That would be me, a licensed clinical psychologist.
That is correct.
Can I have a caveat here?
Absolutely.
Okay. That is not to say that a trained LPCC cannot do assessment testing to figure that out, or from what I understand, because I've been challenged through this, depending on,
I was just going to say, we know the
that's
LPCC
right.
is covered.
Right. Okay.
All right, scenario 4. I'm grieving the loss of my father, and I'm struggling with my faith. I don't know how to reconcile this loss with what I believe about God.
So definitely go to your pastor. And the part that triggers me is depending on how they are surviving or how they are doing with the grief, the pastor and a referral to LCSW, LPCC, or a psychologist.
And we know that sometimes they overlap.
Yes.
But these were some clear ways.
Those were excellent scenarios, excellent questions, and wow, I have really enjoyed this.
How many
I
did
love
you
the
get right?
game. That was so good.
Yeah, I wanted to, that's the coach in me, is practical application. So I'm always looking, if I provide information, how am I helping them to practically apply it to their lives? And for me, it was like one of the best ways to identify, did we get the information across, was to play a game to see, can we attach it to the right person?
So how well did you do, audience?
How well did you do? Be honest. There was no pass or fail, but I hope that you grew. I hope that you learned. And I hope that this conversation of truth and transparency opens up other conversations.
I agree.
All right. Well, thank you for being here today. Look forward to seeing you on our next podcast. Like and subscribe and share.